Neural tube defects (NTDs) encompass a range of congenital anomalies resulting from incomplete closure of the neural tube during embryonic development. Neural tube defect mainly occurs due to folic acid deficiency before pregnancy or during pregnancy. Always start folic acid as you plan to conceive, especially in first trimester. Folic acid is very necessary. The main types of NTDs include spina bifida. In this condition, the spinal cord and its covering do not fully close. Spina bifida can range from mild to severe, depending on the extent of the spinal cord involvement. Spina bifida occulta. This is the mildest and most common form of spina bifida. It involves a small gap in one or more of the vertebrae, bones of the spine, but the spinal cord and nerves usually remain undamaged. In many cases, individuals with spina bifida occulta may not even realize they have the condition because it often doesn't cause symptoms or require treatment. Meningocele. In this type of spina bifida, the protective covering meninges surrounding the spinal cord protrudes through the opening in the vertebrae, forming a sac filled with cerebrospinal fluid. However, the spinal cord itself typically remains unaffected. Meningoceles can usually be surgically repaired with a good prognosis for the individual's neurological function. Myelomeningocele or spina bifida cystica. This is the most severe form of spina bifida. In myelomeningocele, both the meninges and the spinal cord protrude through the gap in the vertebrae, forming a sac filled with cerebrospinal fluid. The spinal cord is often damaged, leading to varying degrees of paralysis, loss of sensation, and other neurological impairments below the level of the lesion. Treatment usually involves surgery to close the opening and manage associated complications. Anencephaly. Anencephaly is a severe NTD characterized by the absence of a major portion of the brain, skull, and scalp. Babies with anencephaly are typically stillborn or die shortly after birth. Encephalocele. Encephalocele occurs when part of the brain protrudes through an abnormal opening in the skull. The protrusion is covered by a sac-like membrane. These defects can vary in severity and may lead to lifelong disabilities or even death in severe cases. Early detection through prenatal screening and interventions can help manage and reduce the impact of NTDs on affected individuals.